So why a facelift alone isn't enough? Now you see it all the time. A surgical office, all of a sudden everything's a facelift. You got to get a facelift. Only a facelift works. Threads are bad. Lasers are bad. Fillers are bad. Fillers migrate. It's called FUD. Fear, uncertainty, and doubt. Don't let people put that in your head, and here's why it's important. I'm going to give you 3 reasons why a facelift isn't enough and why you see pure surgical offices. Next thing you know, they're offering fillers. Next thing, they're offering lasers. Next thing, they have a whole filler side, a med spa side to the practice. Why is it? It's because a facelift isn't enough for these 3 reasons. And before we start, I like it all. And unfortunately, many people need it all. Meaning they need it all because in their mind, they have a result that they want to see. And in order often to get that result, depending on the age and stage, that's what would need to be done to achieve it, whether people like to hear it or not. And a clean example of that is someone asking me about going on a retinol, going on skincare, will it get rid of my jowl? And unfortunately, it's so complex. It's fat pads, it's reopposing of the tissues, it's loss of bone, it's overuse of musculature. It's very complex. So these are the reasons why a facelift isn't enough. Number 1 is bone loss. So we have to understand what a facelift is. There's many variations, but we're going to basically refer to what is probably the best procedure, in my opinion, which is, when you need one, a deep plane facelift, which used to be cutting here, taking the skin, moving it back, and you would have heard people say, oh, I'm on my 3rd or 4th facelift, because it was about stretching the skin, whereas now it is more about releasing ligaments and opposing the tissue differently, mainly in a lifted manner, be it straight vertical, in some areas straight vertical and lateral. Everyone's going to be different and have different needs, but the point of it is, when you make those cuts, you remove the skin, you move the tissues, you don't change the what? The bone. And as I'm sitting here, my head's on a bobble. It's not seeing resistance like my hip, like my spine, and when it does see resistance, that builds the bone. So the head not seeing resistance, think of it as crumbling. The bone, a bit dramatic for sure, but understand there's a lot of remodeling of the bone in the face, and the facelift will not change that. And if you watch my video on looking old versus tired, I talk about fat pads, I talk about bone. Bone is often what you're seeing when you say, that person's looking old. You're thinking in your mind. You don't say it because you get in trouble. But you look at someone and go, wow, I haven't seen them in 4 or 5 years. They're looking old. Typically, they've gone from 45 to 55, 50 to 60, whatever it may be. But often it's the bony changes. And watch my video on the bone, and here's a picture of new bone versus old bone, so you can just see the changes around the eyes. The eye socket gets larger. It rotates the wrong way. Down, we want the eyebrow up. You look at the bone in the center of the nose, it kind of opens up, so there's more black area. There's more hollow in the face. The jawline bone here gets very narrow. People lose the mandible, the teeth, all those things. And you can watch my video on K2 for ways that you can help restore your bone or things you can do to maintain your bone. But the facelift doesn't change the bone. Number 2, it removes skin. As we said, it does not increase dermal thickness. It does not help with collagen or elastin. And we know loss of collagen, loss of elastin, loss of hyaluronic acid. Now you know hyaluronic acid from serums, from cross-linked hyaluronic acids that we inject to make them last longer. But your own body's producing hyaluronic acid and breaking it down. It produces collagen and it breaks it down. It produces elastin and it breaks it down. That machinery is great for most people. Age 10, 20, 30, 40, it starts to slide. We get increase of MMPs, collagenases, things that chew that up and get rid of it. And so we need to boost the machinery up. But a facelift does not do that. As an example of some things that do, which you're going to hear them damned by a lot of people, but PDO threads, biostimulators, Sculptra, PLLA, platelet-rich fiber in your own blood product from your own body if you want all natural. And then, of course, devices, heating, microneedling, whatever floats your boat. I'm not tied to any one. I use the ones that I like best, that I think work the best. And I have a variety for each patient because everyone's a little bit different. But understand, taking skin away from here, moving everything up, reopposing tissues, it's great, wonderful. I'm going to get mine. No problem. I like it all. However, it's not going to make my skin here any different than it is today because I removed it back here. Number 3, it does not help with a lot of what we talk about on this channel, which is pore size, sunspots, redness like rosacea. We talked about the thinning of the skin, but there's also changes in the fine lines on the surface of the skin. It's not going to change any of those things. If you think about a mole here after a facelift, it might be over here, but it's still there. We remove the skin back here. So what do we do for those? That's where skincare is so important. CO2 laser, how many people get on the table when they're getting a facelift a CO2 at the same time if they can handle that downtime? That's why we do fractionated RF. It's why we use growth factor skincare. It's why you might do microneedling at home, the Dermaroller Anti-Age system with growth factors to help build the skin and help with sunspots, the redness, the fine lines, all those things, because a facelift won't help those. And it's exactly why you see a surgical practice only always talking about surgery, 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 and then it shifts over towards all of a sudden they're running lasers, because many people need it all. So a lot of people ask me the question, oh, I'm just going to wait and get a facelift. I'm not going to bother with all the rest of it. It's too much. I can't understand it. There's so much out there. I feel like I'm being ripped off. I'm just simply going to get a facelift when the time comes. And it's the wrong way of thinking if you want to maintain the bone, the skin, the fat, and have a nice, confluent, beautiful, youthful skin. And I'll do a whole video on what is beautiful skin. What's the difference between beautiful, youthful, Korean glass skin that everyone talks about on this channel versus skin that doesn't look vibrant and alive and young and youthful. We'll do a whole video on that, but I wanted to address exactly why a facelift alone won't do it, and it's the wrong way of thinking in my mind. I want to hear from you. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.